So I don't normally jump on that health insurance is a scam, but today it is absolutely a scam, and I swear it's fraud. I need an MRI on my back because I hurt my back. My clinic sent it over to a hospital. They ran it through my insurance. They called me and said, hey, your portion of it that you're going to have to pay after insurance is $5,100 for this MRI. So I'm like, wow, okay. I was like, before we do that, like, just wait, because I'm like, $5,100 just seems wild. I called another place who was also waiting for my insurance to go through to see how much it was going to be. My insurance was still on hold with them, but I asked them, hey, if I just cash pay this, how much is it going to cost for this MRI? And they're like, well, if you just want to cash pay it, not run anything through insurance, it's $700. And so I'm like, sounds a lot better than $5,100. So I called the original hospital back and said, hey, if I don't run this through insurance, what is the cost if I just decide to self-pay it, since I know the other place is $700? The lady's like, I'll rerun it under you being self-pay and I'll call you back with your total. So a few minutes go by, the lady calls me back and she goes, hey, I talked to my supervisor. Since you have insurance, we are not going to let you self-pay it, so we won't give you that number. How is that not a scam? Isn't it my choice if I want to self-pay something versus running it through my insurance? How I should get to decide that, not you, but they're like, nope, since you have insurance and you've already done it that way, we are not going to allow you to self-pay it. And I think that's because they probably were going to give me a self-pay price, kind of like the other place, maybe a $700, maybe up to $1,300, still way less than $5,100 that it was going to make me pay. And I just think, like, what if somebody wouldn't, like, what if I wouldn't have called around? I would have been stuck with this $5,100 bill. Insurance is such a ripoff. I don't know how in the world this hospital is telling me that I now can't self-pay it. What does it matter? I'm going to go to the other place, but I don't know how this hospital is allowed to now tell me, hey, yeah, you can't self-pay something if you have already had us run it through your insurance. I haven't even had it yet.